Hi, I'm Laura and welcome to class today. Today's class is going to be focused on hip mobility and strength. And the only prop that you may need today is a resistance band. You can use anything that may substitute a resistance band that you have at home. It's just going to be to aid an exercise that we're doing. And you can also do the exercise without the aid. So before we get started, as always, we're checking as we go through that we're kind to our bodies, making sure that we're taking any alternatives or changing our exercise if we need for our bodies. Okay, use any exercise during the class that you might want to come back to. So let's get started. Bring your feet to the bottom of your mat and then gently roll down onto your back. And let's spend a few moments finding our alignment. So bringing the feet a comfortable distance from the bottom, heels roughly in line with the sitting bones, and the knees roughly the same distance as the feet. Checking that the chin is tucked in so the back of the neck is long. And then bringing your hands to the front of the pelvis to create a triangle. So we're identifying where the two pelvic bones and the pubic bone are. And I want you to make the three bones at the front of the pelvis so that they're level with each other, making adjustments as you need. And as we bring those three bones so that they're level, this brings our pelvis into neutral. Checking now that the lower back is light, or it may be lifted off the mat, the rib cage is heavy, and we've still got that length to the back of the neck. Now if the rib cage isn't on the mat, and we're feeling that that's difficult to achieve, we may want a block underneath the head, or a pillow, or a towel, and this is going to make that easier to achieve. So now we've got neutral pelvis and spine alignment, our optimum position. We're going to bring our hands to our rib cage, slide them wide and bring in our thoracic breath. Breathing in to expand the rib cage to the sides and to the back. And on your out breath, narrowing the rib cage and letting the rib cage come away from the hands. So using this breath and using the feedback from the floor to feel how wide and how much oxygen we can bring in and how much carbon dioxide we can let out and how narrow we can make the rib cage. So really trying to breathe as deep and as full as we can. Now on your next out breath, gently lift the pelvic floor up and draw the navel in towards the spine, engaging the transverse abdominis. And now continue to breathe, keeping the control in and up of those two muscles and reinforcing the engagement of them every time you breathe out. And let's keep going with this breath, core connection, but bring your hands down to your two pelvic bones. Now we're going to explore the movement that happens from the hips to begin with. And we're going to focus on keeping the pelvis and the spine stable, which is going to work the core. So on your next out breath, keeping the pelvis, rib cage, back of the skull on the mat, the lower back light, the back of the neck long, you're going to exhale and open the right knee out into a knee drop. And inhale, bring the knee back in. Other side, so we exhale to open and we inhale to close. Now as we change the working leg, the moving leg, you might notice how the pelvis wants to tip and rotate towards the moving leg. So what we've got to do is, whichever the moving leg is deepen the opposite hip to keep the pelvis still. This makes then the movement isolated at the hip joint. And the movement that's happening at the hip joint at the moment is external and internal rotation. So as we move out, we're going into external rotation. As we move in, we're coming back to internal rotation, or back to parallel, okay? So we're going to keep going with this exercise, and we're just noticing where our mobility is, how far we can go in our hip joint without moving the pelvis. So it's a combination of stability and mobility. Now once we've gone with the left side, we're now going to change the exercise. We're going to go to a heel slide. So as we slide the right leg out, we come into hip extension. And as we slide the leg in, the hip comes into flexion. Changing sides. We exhale to reach out, to extend the hip, and we inhale to come in to flex the hip. We're also getting extension and flexion through the knee, but again, we're focusing on the hips today. Now, as we extend the hip, if we're tight in the hip flexor, the front of the hip, the pelvis is going to want to tip forwards, which is going to arch the lower back. So here is where we need to think of lifting the pubic bone up towards the belly button, working the core, stabilising the pelvis, and giving more chance of mobility to happen at the front of the hip. Okay? Extension is opening the front of the hip, working the back of the hip. Flexion is doing the opposite, so working the front of the hip and extending and opening through the back of the hip. Okay? Now when the left leg comes back in, we're going to extend the right leg out, and we're going to work on this flexion and extension a little bit more. So deepening the core connection, rib cage heavy, pelvis neutral, and on your exhale we're going to lift the leg up, so working deeper into hip flexion and then lowering down, coming back to hip extension. Now again, we're checking that the pelvis doesn't tip back as we come into hip flexion, and the pelvis doesn't tip forwards to arch the back as we lower the leg into extension. So we've got to keep the pelvis still to get optimum movement and work around the hip joint. Okay, so as the leg comes closer to you, drop your sit bones and your tailbone down to get more of a stretch at the back of your leg. Now as we lower the leg, lift the pubic bone up to extend the front of the hip. Leave the leg there, slide it in, and let's change sides. So extending out, and then we're going to start to lift and lower. So feeling the thigh bone heavy in the hip socket, feeling how the centre has to do the work to stabilise spine and pelvis. Then we can work more around the hip joint. So a lot of today is going to be working on stabilising your centre. The more we're stable through the centre, the more we're going to work through the hip joint. So we're just going to do one more. Are we more flexible or less flexible on this side? And then slide this leg in. Now we're going to go back into our heel slide with our right leg. We're going to keep this leg here and let it rest on the ground. We're going to work a little bit more into external and internal rotation. So as we externally rotate the thigh bone, I want you to rotate it outwards, and the knees and toes will face towards the outside of the mat. And then we're going to rotate the thigh bone inwards, turn the knees and toes to face to the centre of your mat. And let's go again. So we turn out in the hip socket just like a corkscrew, and then turn in. Which movement does your thigh or your hip joint favour? Which is easier? External rotation is much easier for me on this side than internal rotation. So when we come back to centre, you're going to find that parallel position, so knees and toes face the ceiling. Slide the leg in. Let's compare the other side. Let's compare and contrast. So slide the leg out. When you're ready, exhale, spiral the thigh bone outwards. On your inhale, spiral the thigh bone inwards. So we're focusing on the hip joint, the ball and socket joint, the thigh bone corkscrewing in the pelvis. Okay, so the more we move from the foot, the more we're going to be focusing on the extremity rather than what's closest to the centre. So again, I'm feeling that I'm favouring external rotation, but I have got a little bit more internal rotation on this side. And then slide all the way back in. Now this time, we're going to take hold of, our band. And we're going to take our band around our right foot. So we're going to work a little bit more on some of these actions now. So you're going to straighten your right leg as far up to the ceiling as you can. Bend the elbows and just pull gently on the band to bring the elbows and the upper body down. Reach up into the band. So we're really feeling the hip heavy and the rest of the leg reach. We may feel a stretch. We're going to push into the band, and I want you to feel the sit bone area start to engage now. You're pushing something away. Now the sit bone area pushes into the floor now, it anchors into the ground as the leg lifts. And we go again, so we push with the back of the hip. We're taking mind to muscle now. So the body works from where the mind focuses. So we've got to focus on that muscle. We engage the sit bone area to push the leg down. We ground the sit bone area and move from the hip flexor to lift the leg up. So here's where we're going to start to feel the back of the hip and the front of the hip working a little bit more now. So we haven't done one type of movement, and we're going to practice that in a moment. So we're just going to do 2 more, seeing if you can work on drawing the leg closer towards you without affecting your pelvis. And the next time the leg comes over the hip, I'd like you to stay here. Keep the arms exactly as they are. Now this time we're going to open the leg out. We're coming into abduction. So this takes the leg away from the centre of the body. Adduction is when we bring the leg closer to the centre of the body. We're going to go across. So we're opening and lengthening the inner thigh as the leg goes away from us. And as the leg comes across, we're opening the outer hip. Good. So all these movements are going to be working one side and lengthening the opposing muscles. Okay, so we've got 1 more each way. Try and keep the right side of the pelvis as still as possible. Ground the left hip and just make sure that that left thigh bone isn't rolling around to help you here. Centralize the leg and let's take the left leg into hip extension. So slide the leg out. Now if this is difficult to stabilize your pelvis, you feel like your back is arching, you might want to place the foot back down. We're going to take our leg into circumduction now, so lots of movement. It kind of hits all those directions that we've just done. So we're going to take the leg across, adduction. We take the leg down, hip extension. We take the leg out, abduction, and we bring the leg in, and we're coming into hip flexion. So we're going to do 2 more. So we're going all the way around in the hip, making a circle in our pelvis with our thigh bone. Last one, how still can you keep your centre and work the thigh bone in the hip? Let's go the other way. Now often when we do this, we can get a sense of clicking or something going on in the hip. What we can do to help with that is externally rotate the thigh bone and then circle. So this engages the outer hip muscles more and releases the hip flexor. Good, and actually for me that has worked wonders. My hip flexors released now. Now as we come back to centre, we're going to slide the left leg in, pull the abdominals in and fold the leg up, and then change sides. So lowering the right foot down. We're going to start with our extension and flexion. So sit bone area, push as you exhale, inhale as you lift. Now checking into the rest of your posture, have you got the shoulders back and down? Is the neck long? And just checking that we've not got tension in the neck area. So can you use the front of the thigh and the hip to draw the leg closer, as well as the lower abs, and can you use the back of the hip and the thigh to push the leg down? So 1 more time, and as we lift this time, we're going to go out to the side. So abduction, away from the centre, draw the opposite hip down, but watch the knee doesn't go out to the side. And then adduction, across. Feel the drop of the hip, I really feel the stretch on this side. And then again, we go out, and then across. Out, and then across. So as well as mobilising the hip, we're getting lots of stretch around the muscles that connect to the hip joint. So we're going to feel that our quads are going to be a little bit more open, our hamstrings are going to be a little bit more open at the end of this today. So coming back to centre, and if you can, slide the right leg all the way out. Feel free to bend the knee if you need. Let's come into circumduction, so leg circles. We go across the body, down, out, around and up as far as we can. Remember that hip clicking going on. Can you externally rotate the thigh bone? Think of pelvic floor more. Think of sit bone area engaging more. Maybe you need deep abdominals to engage more. Something isn't quite working to stabilise. The hip flexors are overworking. Let's go the other way. So we go out, down, across and up. 2 more. How still is your pelvis? So you don't have to go maximum range at the hip, maximum mobility. But what we have to make sure is that we're working strength to facilitate that mobility. Okay? So we're not just hanging out in our movement. Now we're going to release the leg and we're going to pop the band to the side. Bend both knees in and take your feet as wide as your mat. Arms to the sides into a low V and pin the backs of your shoulders and your arms down. Okay, so we're feeling that width across the front of the body, ribs relax down. So we're feeling the core here. We're going to roll the hips and knees over to the right and almost let the weight of the legs do this. Now as we get to our range, we're going to help this out a little bit by squeezing your left sit bone area, your glute, to push your hip forwards. Think of the front of the thigh lengthening down and the knee reaching to the bottom of the mat. So we're getting hip extension, we're getting thigh lengthening while we're working the hip extensors. And then we come all the way back. So almost just release and let the weight of the pelvis bring you back to centre. Knees come up and over to the opposite side. So this time we push into the right foot. Push the right hip forwards, right thigh goes down. We're feeling the back of the right hip working. So we're noticing how we are engaging the muscles to open the opposite side. Okay. So we can stretch passively where we just in the stretch, or we can engage and be in this stretch. So dynamic because we're moving. Okay. And when we go to the right this time, I'd like us to stay here. We're going to get that engagement of the glute. We're going to push the hip forwards. Now if you can, and your hips allow you to, you're going to rest the right ankle on top of the left knee. Now as well as engaging the glute, the weight of the right leg is going to give us a deeper stretch to the front of the left hip. And we're just going to stay for 2 breaths. Now really open that right knee out. We're going to get a stretch maybe at the right hip somewhere. Now to release, let the right foot slide off gently. Let the knees come up and over. Let's do the same to the other side. So we roll over. If we want a deep twist and stretch, we rest the foot, ankle on top of the knee. Push the knee wide. Push the hip forwards. Reach the thigh bone down. So that ankle's almost pulling my knee down and my thigh bone down towards the floor. And then releasing, sliding off. Bringing the legs all the way back to centre. Bring your feet close again, so this sit bone area. And this time we're going to cross our right ankle across the left knee, flex the foot and let the knee open for our figure 4 stretch position. Pelvic bones are level, arms come back to the side. Now we're going to roll our hips over to the left as if we're bringing the sole of the foot towards the ground. And then we're going to go over to the right, really gently. Kind of thinking of massaging the back of the hips, really opening that right knee each time. And when we go over to the left this time, I want you to see if you can bring the sole of your foot closer to the floor. If it gets there, great. If it doesn't, don't worry. We're going to pause here. We're going to come into internal rotation, so knee comes up towards the arm, and then external rotation, press the knee out and down towards the left foot, really opening that hip. Now again, just comparing and contrast, so how far can you come in and how far can you come out? Can you feel how we have to engage to help push the knee open? Where are you feeling the stretch? This is our last one. Coming back to centre, keeping that position, just checking your pelvis is level again. Arms to the sides of your mat. We're going to push down into the left foot and send the pelvis straight up. Try and think of separating the thighs open. Pubic bone lifts. Lower down. We're going to do 3 more. So 4 in total. Pushing up and down. So driving from the sit bones, opening the front of the hip and lower. And push and lower. Last one. and then release. Let's do the same on the other side. So left ankle across, pull the toes back, push the knee wide. Arms to a low V. We're going to go over to the right and then over to the left. So trying to keep the pelvic bones level, the sides of the waist equally as long, because again we're working through our alignment as well as what's happening in the hips. And just notice what feels different on this side again. Now we're going to go over to the right and we're going to bring the left sole of the foot as close to the mat as you can, maybe it finds the floor. And then we come to internal rotation. Relax the back ribs, front ribs into the back ribs. And then external rotation, push. I definitely feel I've got a bit more mobility on this side. I get less of a stretch. Have to use the back of my hip more to find more stretch in my hip. And then when we come back out into external rotation, come back to center. Check the right heel is in line with sit bone, pelvic bones are level, and we push up. So neutral bridge, push into the foot, sit bones lift, pubic bone lifts, and then lower. Try and think of separating the thigh bones, rolling them out, and then in and lower. 2 more, push and lower. Last one, push and lower. Release the leg and then just hug the knees in a moment. Take some gentle circles to one direction and then over to the opposite direction. Okay, coming up, we're going to roll up if we can, so push gently into the thighs to rock all the way up and bring the feet and the knees back behind you. Coming into a quadruped position to transition to a lunge. So you're going to step your right foot forwards between your hands. And if you can, bring your hands up to your thigh. So knee roughly over the ankle or a little bit further forwards and the pelvis a little bit in front of your back knee. Now lifting the chest up, you're going to sink your hips forwards and down. Now from here, come into a hamstring stretch. So hands to the floor, or keep them on your thigh. Push the hips back, maybe lift the toes. And let's go again. So hips come forward and down. You can keep the hands on the floor or lift. I feel that lifting my hips, my chest, helps to elongate the front of my hip more. And again, so we push back and then forwards. Last time, so as you go into your hamstring stretch, pull the right hip to the wall behind you. And as we come into our lunge, send the left hip forwards. Now to come out of this, bring your hands down, bring your hips back a little. Now lift your back foot up, swivel the foot over to the right, and then turn your hips. What we're going to have to do is slightly heel toe the right foot forwards, okay? So we've come into this side lunge position. Now hip bone square, and this time we're going to shift to the side and then pull back in. So trying to open up the inner edges of the hips now, the inner thighs, and we're just going to do 3 more. Just going a little further each time if we can. And 2. Last one. And then as we come out, we heel toe this foot back. Start to turn. We rotate the back foot, hands come down, and then step back. Change legs. So we come forwards with the left foot this time. Knee about over ankle, pelvis forwards of your front leg. Sink the hips forwards and down. Hands up to the thigh if you can, lift the chest. Try and reach your right pelvic bone forwards. Tuck the tail under a little, lift the pubic bone up. Now if you can, hands stay on your thighs, or we come down to the floor with our hands to find our hamstring stretch. So reach the left sit bone back. The leg doesn't have to straighten for you to find a stretch. Let's go a little bit quicker. So we come forwards, hand to thigh, lift. Right hip pushes forwards. Hands come down, left hip pushes back. So keeping the abdominals engaged. As we come into that hip extension, pubic bone lifts. A lot tighter on my right side. And just noticing where you're tight. So this is our last one. And we bring our hands down, mobilise that foot around, so pivot, and then we're going to face the back. So our side foot, heels and toes forwards a little, so our knee is slightly in front of the hip, and then we're going to press out to the side and then come back in. So trying to target the inner thighs. The more you keep your pelvis square to the wall in front, the more stretch you're going to feel. Make sure your knee, your left knee, is pointed in the same direction as your second and third toe. And we've got 2 more. How are we getting on? Last one. And then we start to heel toe the left foot out to the side. Pivot our right foot out. Hands come down. And then take your left leg back. We're going to transition into a side lying position now. So come all the way down. And you want to align the feet, the pelvis, the rib cage, head and neck in the same line. Top hand to your hip and push the hip all the way down. Squeeze the feet together. Press out with the thigh and then in. So we want to feel the waist is light as we're doing this. You may have a space or not. Pelvic bones are stacked. And we're really drawing the shoulder blades back and down. Now as you push your top knee open, coming into external rotation. So we're working the outer hip, we're stretching the inner thigh. Okay, so squeezing the heels together and maximising that contraction, really stabilising the pelvis to get the work at the hip joint. Now just 2 more. And then knees together, squeeze them together. Now internal rotation, so we lift the top foot up, lower it back down. So noticing now you're going to feel the work on the inner thigh, we're going to feel a stretch on the outer hip. So we've changed where the work is, and then lower. Try and squeeze the daylight out of the knees, squeeze the inner thighs, you're really thinking of where the thigh bones meet the hips. And last 3. And 2, last 1. Good, excellent. Now turn both thigh bones out in the hip sockets. Squeeze the legs together. Start to extend the legs. So the legs come slightly forwards of you and then lower them down. Okay, keep the legs turned out. We lift up and down. We've got 8, 7. Keep the waist lifted. 6, 5, 4, 3, 2, excellent. Last one. Now internally rotate, so lift the legs slightly, turn them in, heels apart and lower. Now leg lifts up and down, not moving as far this time. Lift and lower, lift and lower. Good, 7, 6, 5, 4, keep trying to lead with the back of the leg. Good, last one. Now turn your legs to parallel. Lift the top leg, flex the foot, we come forwards, hip flexion, point reach back, hip extension. And 7, bit quicker. 6, 5, how still can your body be? 4, 3, 2, excellent. Last one, reach back, stay back. We abduct away from the center, adduct, lower down, and lift and lower, a bit quicker. And 3, 4, 5, just gonna do 6, 6, hip height, now forwards, hold, abduct, up, adduct, lower, and 5, 4, 3, keep the pelvis still, 2, last one, good, bend the knee in, keep the inner edge of the foot down, now inner thigh, lift and lower, now working the inner thigh to extend and lengthen the underneath legs, outer thigh, good, and 4, 3, and 2, 1, lift and pulse, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release. Legs together, push up, and let's go all the way onto the other side. So we start with feet, hips, shoulders, head and neck in the same line, hand to hip, press the feet together and push out, squeeze in. So staying with your clam, find that waist lightness or the space. So this is going to bring our spine into complete neutral position. It's going to make sure that we're working the core, we're stabilising the spine and the pelvis. So always working our core, even though it's not involving movement of the spine. Okay. Now last 2. Keep the knees together, internal rotation. Press out and in. Out. Now squeeze the knees together. You're trying to get rid of any space between the inner thighs as you rotate the thigh bone inwards. And just notice how this differs from the other side. Maybe your pelvis is moving more. Reduce your range if that's happening. And last 2. Last 1. Now feet together, turn both thigh bones out. So your bottom knee's trying to turn down, top knee's trying to turn up. Extend the legs so they come forwards of the hips. Keep them in external rotation, check your pelvis. So the heels should be stacked here. We lift and lower, lift and lower. And 8, 7, 6, keep trying to spiral the thigh bone out. 4, 3, how's your core getting on? Is it still lifting the waist? Good, now hold, internal rotation, so lift the legs slightly, turn the legs inwards, and then lift and lower, lift and lower. 8 more, 8. Try and turn your inner thigh to face the wall behind you. The knees trying to face the ground, pelvis is trying to stay stacked. And 3, 2, last 1, turn to parallel, lift the top leg, flex, so we come into hip flexion, point, hip extension, bit quicker. And reach. How still can you keep your pelvis? This is a lot harder on this side for me. And we've got 4, reach, 3, keep breathing, 2, relax the shoulders, last 1, hold it back, lift and lower, 5, 4, pubic bone lifts, 3, 2, last 1, parallel, come forwards, flex, lift and lower. Can definitely tell that this is my weaker side. It's really fatigued. And 3, 2, but this is where we find the work. Last 1, come in, bend the knees, give it a little massage. Oh, I forgot the inner thigh, so bend the top leg. Reach the underneath leg long and lift and lower. So not forgetting the underneath leg. Can't do that. Lengthen the leg out of the hip. Think of dropping the top hip down and really try and lift as high as you can. Try and keep the knee facing forwards. Mine wants to roll inwards. Now we're going to lift and hold. Pulse 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release. Excellent, everyone. So just releasing the legs. And we're going to come onto our front now. So coming around so that your hands are underneath your forehead. Whoops, having a hair issue. And you're going to lengthen your legs back. So to hips distance or a little bit wider if you need. And then just let your body release. Shoulders relax down. Notice where your natural alignment is, where your pelvis is positioned. And what I want you to feel is, where's your pubic bone in relation to your pelvic bones? Can we make them level now? So for me, I have to deepen the pubic bone slightly into the mat so that my 2 pelvic bones can be level with my pubic bone. Legs are going to reach back now, so slide them along the mat, trying to reach them further than the bottom of your mat. Open up the hip creases into the floor. Sit bones start to narrow. Now, if you've got something to support underneath your forehead, just let your hands come around so that your fingertips rest just underneath your two pelvic bones. Okay, use your glute muscles to really try and press the fronts of your hips into your fingers. Bend your right knee, bring your heel towards your sitting bone. Can you make sure the fronts of the hips stay heavy into the fingers? Reach the leg back, straighten it, then lower it to the floor. Same on the other side, so bend the heel into the sitting bone. Pressure on the fingers stays the same, reach back and then lower. What tends to happen if we're tight at the front of the hips is the hips start to lift off the mat as the heel comes in. So we want to feel that we're working the back of the hip here and the hamstring to open the front of the thigh and the hip, okay? So we're just doing a little dynamic stretch here, just feeling what's happening, what engagement we need. When you're confident that your pelvis is still, the front of the hips are staying open, you can return your hands underneath your forehead. Once we've done the left leg this time, we're going to keep the leg straight, we're going to reach back with the right leg and lift and hover. Now, changing sides, you're trying to imagine or visualise the fingers still underneath the hips, and you can take them back there if you like. We're going to do one more each side, keeping the belly lifted, the pubic bone heavier, slightly heavier than your two pelvic bones. And if you can, we're going to lift two legs. So we lift up and lower. So the challenge is to stabilise the pelvis, the lower spine, while we work the back of the hips and mobilise the front of the hips. Okay, two more. Now lift the legs, hold them there, turn them out in the hip sockets, take them a bit wider, lower them down. Keep the legs extending, bend the knees, heels come together. So we're in a wide diamond position. We're going to exhale, squeeze the heels and push the legs up. Inhale, lower. Exhale, push. Inhale, lower. We've got 4 more. And 4, 3, 2, 1. Now release the legs. Give them a little shake out and in. Let the pelvis go. Might feel nice just to rock the pelvis side to side. And then hands by the shoulders, push all the way up, take a quick child's pose, open up the back of the hips. And then just coming down to a sitting position, you're going to take your feet forwards, hands behind you, and a little window wiper here, so we roll the knees over to one side and then up and over to the opposite side. And we are done for today. So thank you for joining me today. I hope you enjoyed the class, and if you've got any questions or queries, please feel free to get in touch. And if you haven't yet, subscribe below and click the bell icon for future notifications. Hope to see you again soon. Take care. Bye.